at least for us, the doctors were just saying it was normal, or it happens that there's a genetically normal, like 20-week loss with no other explanation. And I wish somebody would actually have told me, like, no, that's actually not normal. And it's very, like, usually that there's some other explanation.
In the process, you could tell that they felt some level of grief and pain. And
Heather and Justin from Washington, D.C. When we came to Fab Fertile, we had been through 3 pregnancy losses and without any living children.
most every doctor we had talked with said these kinds of things happen, or this is very rare, it probably won't happen again. But there was no definitive answer giving us to anything pinpointing of what kept leading us to loss. I think I had some skepticisms in terms of, if the doctors didn't have an answer, what makes me think spending money here would change that?
I think there was just a lot of ability to focus on a lot of lifestyle aspects of trying to have a baby.
I think the team was very good about explaining the why as to each test, and even like a little bit of snippet into like what the next step would be depending on what was found. Kind of helped give some more tangible action steps and things to kind of look forward to.
Got pregnant again, like while working with Fab Fertile, but then again, that was another loss that was unexplained. So, like, on top of the work I'd done with Fab Fertile to reduce inflammation and like change diet, I was able to get on like some immune medication and blood thinner medication that this year allowed us to have a baby. So that doctor was happy that we were working with the nutritionist and doing all the lifestyle things as well, so that, like, kind of coming at it all ends and making sure that, we had the best chance of having a healthy pregnancy.
Yeah, I think in terms of like trusting the process, once they said, hey, try and do this, and tangible things were happening that were changing, that were better, it at least, if not trust, gave a little more hope or just ground on which to like keep going.
I think I would like others to maybe take that if this is something they want, and if they don't think that they're getting the right answers, I don't think it's a bad idea to explore other avenues.
Yeah, I think in terms of what to tell people in their loss is, it sucks to go through it. There's nothing harder in terms of the loss, not to like push it down, try and push it away. It was also supportive and helpful to have somebody going along with these changes, even if they weren't directly for me, instead of just having one person kind of feel like they're doing all the changes. Doing it together is very important.